Welcome, everyone. And thank you so much for joining us at the Indegene Digital Summit. We're excited to bring the fifth edition of this summit. To begin with, a very big thank you to all our speakers and audience who have joined us from all over the world. Your practitioners' perspectives and engaging conversations have been inspiring us to bring this event to you every year. Over the next 2 days, you will hear from your peers on topics that matter to the life science industry today. Commercialization, data analytics, digital adoption, generative AI, brand launches, and a bunch of other things. With that, I'm pleased to introduce a phenomenal leader to kick off this year's summit. Sharon Babalu is the Chief Financial Officer of North America for Teva Pharmaceuticals. I'll let Sharon talk about her rich professional journey and background, but as a very quick intro, Sharon has more than 2 decades of experience in various roles that include commercial also in Merck, followed by a stint in the biotech industry. Thank you so much, Sharon, for joining us today, and welcome to the Indegene Digital Summit. It's a pleasure and honor to have you over here.
Thank you, Manish. It's a pleasure and honor to be here with you and with everyone joining us. And I'm excited and inspired by the work that you're doing and that others around the industry to make healthcare better.
Thank you, Sharon. Thank you. Sharon, why don't we just start with this session with you walking our viewers through your rich and diverse functional experiences and backgrounds. As I said, you have had biotech, small company, large company, various functional experiences. Can you just talk about them and very briefly share also how they have shaped you?
Yes. For me, it's been a humbling experience to be part of the life sciences industry, and where we put patients, customers at the forefront of what we innovate and what we do every day. It is very motivating to be part of this industry and what we are doing today and for the future of changing patient care and changing the landscape in the US and around the world. For me, I've had the pleasure of being part of large pharmaceutical companies, seen it from the biotech end of innovation and entrepreneurial environment, and also US, ex-US, global companies and how we operate. And today there are very much challenges, but we turn them into opportunities. And so I'm excited about what this industry is doing, and being at Teva today allows me the opportunity to bring more innovations to patients and customers.
Excellent. Excellent. So my next question, Sharon, is something which has confounded me for the last 25 years. That's the time I've spent in this industry. As an industry, we are inherently innovation driven, right? Our industry is based on innovation. But why does innovation stop at the traditional R&D side of things? What do we need to do to apply the same innovation mindset throughout the value chain and the entire enterprise?
I believe that best-in-class companies innovate end-to-end, and that the innovation does not start or end at the R&D side. It is all throughout the innovation cycle, from R&D to commercialization to every function. Looking at innovation, we keep in mind every function along the way to support our patients, to our customer experience, and what we need to be doing to push the envelope to transform and disrupt. That's a very exciting part of being part of this industry, not just, again, for who we serve, but also how that, as a CFO, can translate into growth and profitability for our shareholders and investors. One of the most exciting areas for me is how we are thinking about personalized customer and patient experience. This is not new to some industries outside of life sciences, but it is an emerging trend, and a trend that is pushing the envelope of how we think about touching a patient or customer and the experience that we want for that patient or customer from the entire journey. whether they are part of a clinical trial or a patient on therapy, or how we serve them from the customer end all the way through. So for me, I'm very excited about the personalized customer and patient experience that we're pushing the envelope for, and how we use data to transform that experience and creativity.
Sure. Makes a lot of sense. We are in this environment of extreme change, as I would call it, on multiple counts, right? On one hand, you hear the science, cell therapy, gene therapy, CRISPR, you can go on the really exciting science that is happening. We have generative AI, right? And all kinds of prophecies about what's going to happen on the AI side of things. You have quantum computing, so much change going on, right? On all these things coming together. How do you see that affecting the innovation happening in our industry? So this environment, how is it shaping innovation in our industry? And how are you personally challenging the traditional thinking and getting people, your organization, to think in a more innovative way?
It's a great topic, and one that I spend a lot of time thinking about. It starts with innovation at the mind as a mindset in the culture of a company, embedded, whether it's a small company or a large company. Innovation and that mindset has to be forefront, so that we are thinking about how we are putting in place activities and strategies to support meaningful outcomes for our patients and the innovation there. I will say that the market is constantly changing, and the best-in-class companies are constantly looking ahead, not just for today, performing for today, but transforming for the future, and anticipating a patient's needs and where the innovation is headed. I'll give you a couple examples from the life sciences side for commercialization, having spent as a CFO some time on the commercialization side. There's some very interesting trends around patient-driven care, the customer experience changing with the care delivery models and landscape, and digital capabilities as well. So innovation for the sake of innovation is nothing, and data for the sake of data is nothing. But when we pull it together and tie it to these market trends and anticipating the future, it's incredible what we as an industry can do. So Manesh, for that reason, I'm excited about the changing landscape, but at the forefront of all of it, we need to be thinking about how the market trends and where we are headed, and how we as an industry can be ahead of it.
Sure. You mentioned about anticipating needs, and that just brings me to the next question. And this one, I'm going to try to put you on a spot, given that you're a CFO. We conducted a study of 100 life science leaders and found that people talk about financial resilience among the bottom 3 attributes for future readiness, right? And being prepared for the future. But also, it is one of the highest priority things for most of the life science leaders. First of all, why do you think there is this difference in these two different, if you would call it, data gathering mechanisms?
I was reflecting on this question and why there might be this dynamic. It could be that we and the individuals within a company are thinking about capabilities for today, but not necessarily thinking about what it takes to be profitable for the future. And let's take a small company, for example. Small companies are constantly thinking about how they can make rapid decisions, take an entrepreneurial approach, put in place very scrappy ways and resources to accomplish a key goal. Now, that to me is very creative. They're not encumbered by systems, processes, or historical legacy ways of doing things. So in this case, their financial resilience could be seen as very adaptable. However, as we know, in the markets, it's proving what your capabilities and innovations are today to secure that next financial resource. So in this case, it's a common reality for small and large companies. Large companies are have stood the test of time with being being around decades. Part of some of the companies I've been part of. Now, the financial resilience part of it is that companies are constantly thinking not just for today, but the future. So that balance is so important. And often we get tied up in the day-to-day aspects that the financial resilience may not be top of mind. But I, as a CFO and as a commercial leader, also am thinking about both sides of it and encourage everyone to do that.
Sure. So Sharon, let me just extend that question and take on from what you just said. How do you evaluate and assess and actually even encourage your organization to balance the conflicting priorities of profits for today, right, and making your margins versus making the right investments, which might pay off in 3, 5, actually in our industry, probably even 10 years later?
I think in terms of talent, there's 3 aspects, and this is an approach I use whether I'm on the commercial side or finance. It's about building teams for the future, and so that they are resilient for the capabilities that we need. It's 3 aspects: trust, shared purpose, and continuous innovation and improvement. So at the hallmark of every team, and how we are upskilling our team, we have to give trust. We have to give safe space. We have to encourage them to think differently, the opportunity that they can fail if needed. I know that's very hard for people to think through. It's easier said than done, but trust is so important as we think about teams and giving them the right environment to thrive and upskill. 2, that shared purpose. Every individual on a team, whether I've had a team of 2 or a team of 200, it's about connecting them to that purpose and what drives them every day for what we need to do and as a company to transform. And then 3, the continuous innovation mindset. Now, there are individuals that are continuously upskilling and learning new skills. And those are the individuals that I feel raise the bar and continuously think about how we do things better. I'll give you an example of this, something that I saw very much in play. When I was leading a data analytics team, and this was a very new team, forming it for the first time. And I became inspired by the industries outside of life sciences and how they leverage data scientists for quick insights, deep insights, and how we can turn them into actionable ways of reaching our customers. Previously, it was slow, fragmented, reactive. But I had a vision of trying to move forward in thinking about the future. And so we leveraged data scientists. But throughout that journey, I realized that we also needed individuals who could translate the business and work with data scientists. So this is a very new type of, I think, learning in life sciences to equip data scientists with business translator. And the key to that success was bringing together and nurturing talent in that type of environment that I mentioned, with trust, shared purpose, and the continuous innovation mindset.
Got it. That resounds so much with me, Sharon, especially the external industry perspective you spoke about. I remember 15 years back when we as Indegene took a bet at omni-channel, we called it multi-channel at that point in time, right? Engagement for physicians, patients will play a significant role. in the future. Our inspiration was the banking industry, where you used to have bank branches, and everybody used to go there, right? And how the industry transformed. The branches still exist, but they play a very different role versus self-service, and a bunch of those things started coming in over here. So that makes a lot of sense. Okay, let me come back to, sorry, go ahead.
Minesh, there's an interesting aspect to that, because when we bring talent from outside the industry, we also need to think about how we are educating and nurturing that talent to learn about the life sciences industry, which may not be the immediate place where individuals think about how they can perform. So there is a responsibility to leaders and to companies that when you bring in this type of new talent or capability, to give the resources and environment to help that type of talent or skill or capability thrive. So that's a very important aspect of this also.
Absolutely, absolutely. Actually, you again brought a very good point, and I think it might be really relevant for our viewers, given that there is this whole experiment, I would call it experimentation, but a drive to get in talent from other industries. What is your take on getting people new people who are coming in from other industries, internalize the regulatory aspects of our industry? And the fact is that you're reaching out to very different stakeholders, right? Medicine, but again, you have to be working much more closely with the physician. And it's a much more complicated system, especially on the commercialization side, right? Than many other industries. So how do you see any tips for our viewers on how to think about getting new people familiar with this whole terrain?
One approach that I've used in the past that I would suggest to bringing in different types of talent and capability. One, you need to, again, spend time and help individuals come up to speed and ground them on life sciences. It can be quite complicated for individuals, but we have so many smart individuals coming into the industry, and that's what really excites me. An aspect of that to consider, which I used, was this quick wins philosophy, that rather than try to boil the ocean with what can be accomplished over 12 months and beyond, is take the business issues that are at hand, the business questions, and simply start from there. List them, prioritize them. Prioritizing is very important, because I think we've had examples, you could probably think of examples where there could be many business questions, and how we begin to tackle those business questions or those challenges in front of us, being laser focused, prioritized, and then allow individuals the opportunity for these quick wins. Have the team or the individual go back and think about it, work on it. There's many advanced techniques, capabilities that you let people have that trusting environment to work in, and come back and iterate. So working in a very agile environment where it does not need to be perfect, but that it advances, and each time we are learning something new. So this quick wins philosophy that I've used is very helpful in an environment that is constantly changing and reacting and looking at how we can do things better.
Makes a lot of sense. Makes a lot of sense. Let me come back to some discussions about the biotech, and you alluded to that briefly in your conversation or one of the statements earlier. How do you see the innovation culture agenda being different in large companies versus what you see in biotech? You're on a couple of boards, you've been in a biotech. So what is the difference you see?
Well, I will say what I see is common. Each company that I work with is always thinking about how to transform and disrupt.
Sure.
That's very important to stay ahead of how we can think very different about the industry and about patient care and about the customers and where innovation is headed from the science perspective. The passion is very common. I've been fortunate enough to work with individuals that are very passionate about the science, the medicine, and how to think about that. So that is very similar. Now, how they go about that could be different. The discipline. Some companies are much more disciplined on the choices they make, and others want to take more of a broad approach of what could possibly work. So there might be more attempts of the and companies potentially, some companies potentially have more resources to accomplish that, whether that is more financial resources, more talent, and so that's what I see as the particular difference is the resources, but the passion is there. And so how you accomplish that passion is the difference, and being mindful of what do we need to perform for today, for our investors, for our shareholders, for the markets that we serve, and then thinking ahead what we need to be doing and building those capabilities for the future. For the companies that are only thinking about today, unfortunately, they may not have a chance to think about the future. So I strongly encourage and think that companies need to be able to plan for the future, because if they're not building the ground, laying the groundwork for the future in terms of new capabilities and technology, which it's a very exciting time to be part of this. I can't think of a more exciting time in life sciences to have these new capabilities and technology. And so companies can't do that overnight. It takes multiple years to build those capabilities. And finding the resources to do that also takes time. Whether that's, again, talent or financial. So for me, the being ready for the future is so important, and companies who are thinking about both of those aspects are going to be in really great shape.
Excellent. There is, I think, well, let me ask you one more question. And given that we are on the topic of talent, which is very clearly something you are very super passionate about, there is always this balancing act to build future-ready capabilities, right, on multiple dimensions. One of them is hiring external talent, right, getting the right experts from outside versus upskilling. So how do you think about that? And the second dimension is building capabilities in-house versus partnering. And you can think about it right from R&D all the way to commercialization. So how do you think about these two dimensions differently?
My thought around this is the best capabilities can come from anywhere. And the best innovation we should be looking as leaders or as individuals in an organization for the capabilities, the innovation, whether that's internal or external. I think if we or I as an individual think that we have all the capabilities, I might be making a very big mistake in capabilities that are outside our four walls, the virtual four walls, and it could be a very costly mistake. So for me, speaking with individuals, with companies, learning about the newest technology, AI analytics is one that I'm very excited about and leverage. I've seen it leveraged in commercialization and finance. I'm excited for what this can do to help us get better insights, better workflows, automation as well. So for me, building that internally may not be feasible, because the best thinking around this is going to potentially come from outside of the company. So again, I encourage leaders and teams to think very broadly, because when you think broadly, you might find gems out there that you didn't realize exist.
Excellent. Makes a lot of sense. Thank you so much for the Sharon. So if I just take a step back, some of the things we heard from you were, I think, some of my important takeaways and something which we don't hear leaders talk a lot about, right? Especially when you're talking about innovation, is the whole thing on talent, right? You're talking about the shared purpose, right? Getting everybody aligned, spending time on those type of the softer issues, right? We get excited about technology, new methods, right? But the softer part is where I guess most of the companies fail or succeed. So that was a very interesting thing you spoke about. The second thing is keeping an open mind on internal, external, having your eyes on the goal, what you want to finally achieve, and then keeping an eye on whether it's best done over here versus also being completely open to partnering. What I again found super interesting is your take on the similarities between large companies and biotech from an innovation agenda, which is so true that everybody is talking about and thinking about disruption. And that's how, again, our industry is structured, right? You've got to be doing that, new drugs, new treatments, unmet medical needs. We focus too much on the differences between those. So those were super helpful. Are there any other critical things you want to highlight or anything else you want to leave our audience with, Sharon, on as they think about innovation, which I'm certain will be one of the most important things over the next 5-10 years, given the pace of change?
I think that, so here's what I would recommend to leaders and individuals. When you are in discussions around capabilities, think about what those capabilities bring. It's often ways that we as individuals need to challenge ourselves not to think in our functional areas. We have great ideas. We're very excited about the newest technologies, the newest capabilities, and how we can transform the industry. And then reality sets in when we are part of our day-to-day, schedules and looking at what we need to accomplish for the here and now, and we may lose sight of what we need to do for the future. So one thing that my advice, not just also as a reminder to myself, but to others, is think about how we are driving and creating value. And how is that changing the life sciences industry? For me, that's very important beyond my functional area. Now, I might sit with the CFO hat thinking about financially how we might be able to afford a new capability, or is our company ready to be taking this multi-year journey and commitment? And what does that mean for how we are trading off other decisions? But at the end of the day, if we are prioritizing and making an investment, then let's make sure we get the best result possible, get the best people, get the best capabilities, get the best thought partners internally and externally to accomplish that goal. These are so important. And I think many times we are not thinking through how to execute on a vision. And when things might go wrong, we have to pivot very quickly. Companies that are less urgent in pivoting quickly, I have seen where there are the challenges, and it's very hard to recover at times from that. So for me, urgency, the ability to pivot when things may not be going the right way, and adapting to the market is so critical as we build for the future.
Excellent. That was super helpful, Sharon. And that's so, I guess that's so important in any way you have innovation happening. Thank you so much for joining us today for this discussion. I'm sure our viewers will learn a lot and find this discussion with you and a lot of the points which you raise super helpful and interesting. Thank you so much for being with us for this session, and for our viewers, hope you have a great 2 days in the Indegene Digital Summit. Thank you.